is everything you need to know about how to work up a thyroid nodule on the step 2 exam, because it can get extremely tricky. So you have a patient that comes in, you palpate the thyroid, they have a nodule. Whether they have symptoms or not, it does not matter. Where do you start? Usually start with something that is non-invasive. Use that as a concept for all of your next best immediate management. If it's your first thing to do, make it non-invasive. You don't have to go for a CT scan. You don't have to go for something crazy. Go for something that is easy, not crazy. So get a TSH, just a blood check, get a TSH, and then go from there. Usually, actually, for thyroid nodules, you want to do a TSH and you want to do an ultrasound. Actually, ultrasound is far more superior than doing a CT scan when it comes to thyroid nodules. Okay, so you get your TSH and it shows as low. Low TSH means that your pituitary gland is putting brakes because there's so much thyroid hormone being produced just by the thyroid itself. So if you have a low TSH, that means that the thyroid is functioning by itself. So now you have a low TSH, then your next step is going to be doing a radioactive scintigraphy, right? And this is basically where you can tell if the nodule is hot, meaning that it's taking up the iodine, which usually means that it's something like Graves, which then you can treat with a PTU or methimazole. But if the nodule is cold, this is where it could be a sign of malignancy, very dangerous. And then you should move to a fine needle biopsy. Okay, let's make it very simple. TSH, TSH is low, do a radioactive scintigraphy. If it's giving you a hot nodule, maybe it's Graves. If it's giving you a cold nodule, that could be a sign of malignancy. Now let's go in the other scenario. You do a TSH and the TSH is normal or elevated. Okay, that means that the pituitary gland is producing so much TSH trying to wake up the thyroid. Hey, wake up, but it's not waking up. That could be dangerous because it could be a sign again of malignancy, which if you have a high TSH, move on to a fine needle biopsy. Know this formula because it's going to help you a lot. They ask so many questions on that. Comment below, let me know what you've learned, and maybe share something with me because I know it can get crazy. Peace.